Welcome back, beautiful tri-state area. You're listening to a moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Up in just a few minutes in our Going Deep segment brought to you by CO2 Lift. Today, we're taking you on one wild ride featuring Dr. Salcedo, the plastics doc. He's a board certified plastic surgeon and the founder of the Plastics Doc Medspa in Corona, California. He specializes in breast surgery, mommy makeovers, liposuction, and Brazilian butt lifts. He is renowned for his expertise in cosmetic and reconstructive procedures. His practice is dedicated to delivering high quality, personalized care, of course, to enhance patient satisfaction and outcomes. His commitment to safety and innovation is above all else. He's going to join me today to chat botched celebrity cosmetic procedures and where Cardi B, Priyanka Chopra, and Tara Reid all went wrong. Welcoming now to the show is the good doctor, Dr. Salcedo. Welcome to the show, superstar.
What's up, Zen? Thank you so much. I'm happy to be here.
Oh
Let's
my
get
goodness.
into it.
This is one trending topic, botched surgeries. People can't get enough of it. I don't know what the fascination with this is, but I feel sorry for the victims that we're talking about. Now, according to the American Society of Plastic Surgeons, complications in cosmetic procedures arise from a lot of factors, including surgeon error, inadequate patient consultation, and of course, poor post operative care. But given your extensive experience in plastic surgery, what are the key factors that really lead to these botched surgeries, as highlighted by the stories like these stars, Cardi B and Priyanka Chopra?
Yeah, great question. I think what patients need to do first is find the right surgeon. I think that's number one, the most important thing, meaning you've got to do your research on the surgeon, look at their before and afters, look at their reviews, and make sure you're finding the correct expert for the procedure that you want done.
Yeah, without a doubt, the American Board of Plastic Surgery, in fact, recommends checking board certification, which I don't think people do, and patient reviews, which I also think people look at maybe the first couple they read as those crucial steps in selecting a surgeon. So you are spot on. Now, how can potential or patients really ensure they select a qualified and reputable surgeon to avoid the pitfalls faced by the celebrities like Bristol Palin and Tara Reid? Like, are you going through recommendation, word of mouth? Do you have a network you recommend? What are your first steps?
So you nailed it right on the head. I think number one is find a board certified plastic surgeon. And the way that you can do that is you can go to the American Society of Plastic Surgeons and you can actually find a surgeon. There's a find a surgeon locator, and you can put your surgeon's name into that database and it will return whether that surgeon is board certified or not. And that's the number one step is don't even start. Don't even look into a surgeon who's not board certified by the American Board of Plastic Surgery.
Okay, now let's pivot to something that has caught everybody's attention this year. It's cool sculpting, and it was Linda Evangelista's botched cool sculpting experience. So, of course, proper patient assessment and realistic expectation settings are critical, but cool sculpting's paradoxal, I think it was adipose hyperplasia, occurs in about 0.025% of cases, so 0.025. But what pre-surgery consultations and evaluations do you conduct to minimize the risk of complications similar to hers, which essentially reversed all her fat deposits and ended up having caused a ton of gain weight for her?
Yeah, absolutely. So, like you said, number one is good patient selection. For particularly for cool sculpting, you want to have patients who have a minimal amount of fat. They just need a little bit of fat loss in certain select areas. It's not someone who needs to lose 20 pounds before they do lipo or cool sculpting. Someone who has excessive fat is not going to get a result for cool sculpting, a good result from cool sculpting. So that's number one. Number two is also informed consent. You need to let patients know that this is something that can happen. We know with cool sculpting, paradoxical adipose hyperplasia is a known complication of cool sculpting. And I'm not being critical of other providers that do it, but I don't even offer cool sculpting in my office for that reason. If there's a high enough risk of something occurring, it's just better. If you want to avoid that risk occurring, don't do the procedure in the first place. So I typically don't offer cool sculpting for that reason because it's a known complication of the procedure.
Thank you for your transparency. Now I see where she went wrong and where many women can go wrong because that is a real thing. backed by science, paradoxal hyperplasia. Now, what pre-surgery consultations do you conduct really to minimize not just complications in cool sculpting, but in all the other surgical areas that you specialize in, whether it's liposuction or breast augmentation?
Right. So again, patient selection is number one. You have to make sure that your patients are a good candidate for the procedure. Whatever procedure you're performing, you have to make sure that they have the potential to get a good outcome. Number two is expectations. You have to set appropriate expectations. Just like with cool sculpting, you have to let patients know there are certain risks that are associated with certain procedures.
Now, you just nailed it. Effective communication, I say, and setting realistic expectations are vital. Studies show that 93% of satisfied patients had a thorough pre surgery consultation, and quite oftentimes more than just one. Now, considering Sharon Osbourne's experience with a botched facelift, what steps really can be taken to manage patient expectations? I'm quite certain she went to a very qualified surgeon who properly must have guided her, but where did she go wrong?
Yeah, that's a great question. So, looking at her before, you can see she had a pretty aggressive facelift done. She had kind of looks like she got a little bit over tightened during her procedure. So, there's surgeons have different preferences of how they like to have their results look. So, some are more aggressive, right? And some patients will gravitate towards a more aggressive surgeon that does more aggressive tightening or more aggressive techniques. Then there's some surgeons like myself who prefer a more conservative technique and a more natural conservative result. So again, that's when it goes back to looking at your surgeons before and after and making sure that you're choosing the correct surgeon for the procedure that you want to do. If you look at their before and afters and it's not something that you think you would like or you would be interested in, you should avoid that surgeon. If you look at their before and afters and you see something that you like or patients that look similar to you that got similarly good results, then you should go with that surgeon.
You make a great point. You make a great point. And of course, to the naked eye, people might look at a celebrity today and say, well, we think she looks perfectly fine. But if you do a comparison of a decade difference, especially in photographs, they don't lie and you can alter as much as you want. But you will see where the botched procedure actually occurred, whether you're a professional or not. And this brings us to the next point. Psychological support and post operative counseling are crucial. About 10% of cosmetic surgery patients experience post surgical depression. Now, in your practice, how do you address the psychological impact of botched surgeries that either you have to repair? I know that Priyanka Chopra went through a major depression after her botched surgery.
Yeah, so this is something that doesn't get brought up a lot, and I think this is an excellent point. There absolutely is truth to this post-surgical depression. Even with great results, some people from the stress of surgery, from the disruption of their lifestyle, will still experience some degree of depression. And I think we don't address this enough. Number one, is the surgeon, what we have to do is listen to our patients, recognize that this is occurring, and be proactive about treating it. Although we don't talk a lot about this, I think actually therapy is not a bad idea at all after surgery, especially if someone's experiencing a moderate to severe degree of depression after their surgery. Counseling may be a good option for managing that. And we don't recognize it enough and treat it enough. And I think that's a problem in our industry that needs to be addressed. And I think it's great that you're highlighting that and bringing awareness to the fact that some people do experience that after their surgeries.
You make a great point. Seeking out a good therapist post procedure, just the same way you would seek out the best, uh, anti bruising or repair mechanisms post procedure, you would do the same for your brain, right? So I think that you're onto something, and treatment. And seeking that friend to talk to or that professional is critical. Now, let's pivot a little bit. Non invasive treatments like CO2 lift reduce risks associated with surgical procedures and provide noticeable improvements in skin texture and elasticity. Studies have highlighted that carboxytherapy treatments increase skin hydration by 117% and elastin production by close to 26%, significantly enhancing, of course, skin texture and elasticity, and that's key. So this non-invasive treatment, to my understanding, works by delivering carbon dioxide to the skin, which then stimulates blood circulation and boosts oxygen levels. It was explained to me that this process really truly revitalizes the skin by enhancing the collagen production, but really leading to visible, brighter, firmer, and these youthful results, right? Now, in light of Cardi B's issues with fillers, what are the advantages of using non invasive products like CO2 lift for facial enhancements? And do you think that this is a fad?
So you took the words right out of my mouth. What can I say now? You said it all. So carboxy gel is fantastic at increasing oxygenation in the tissues. So by increasing that concentration of carbon dioxide in the tissues, it stimulates the body to bring in oxygenated tissue, which has fresh, it has growth factors, it has that high oxygen concentration, which yes, stimulates collagen growth. So in patients who have a mild degree of fine lines or wrinkles and they don't want to necessarily jump to Botox or fillers, this provides them an option that they can potentially delay starting those treatments by increasing the collagen. Anytime we increase collagen in the face, we fill in that gap that creates those fine wrinkles, those fine lines that we would typically treat with Botox or fillers.
That's a great point. I love that you said that this is the prelude to avoiding anything neurotoxin and delaying the process as much as you can and letting your skin age gracefully. But let's go one step further. How can CO2 lift products help in reversing these fine lines and wrinkles and and really reduce the need for invasive procedures um, on a cellular level?
So yeah, like I said, on a cellular level, what you're doing is you're increasing the collagen deposition by bringing in oxygenated blood flow. You're bringing in growth factors. You're bringing in more blood flow. That's going to help stimulate the body to produce more collagen. Collagen is the key to our skin. So all the things that we do, all the non-invasive treatments like Morpheus, radio frequency microneedling, all these things, CO2 laser, all of the treatments that we do to our skin to improve the texture, to improve the quality, to reduce fine lines and wrinkles are all aimed at increasing the collagen deposition in our skin. And that's what CO2 lift helps in doing. So it's essentially a mini hyperbaric treatment, bringing in all that super oxygenated tissue into the cells, and that's what helps increase the collagen. When we do that, we improve the fine lines, we improve the wrinkles, and like I said before, it can delay the need for having to get into invasive treatments like Botox and fillers.
Now, you took the words right out of my mouth. This hyperbaric oxygen chamber has been brought up many times. Dr. Hoyos had compared it as well, CO2 lift products to that after liposuction. Now, CO2 lifts carboxytherapy is also shown to improve wound healing and reduce scar formation by promoting this oxygenation and tissue repair. So, what role does CO2 lift products play in post operative care to ensure better healing and reduce scarring?
Well, if you've ever seen the commercial for Frank's Red Hot, and she goes, "I put that S on everything," right? That for me, that's what carboxy therapy or CO2 Lift Pro is for me. I literally put it on everything now. So whether I'm doing a filler treatment, particularly like so with with Cardi B, where she got the nose fillers, even if I'm doing any kind of treatment where I need more blood flow, where I want that healing to be improved, I use the CO2 Lift Pro. So nose fillers, when I do blephs, so my surgical upper eyelid lifts, I'm putting it on that. When I do chin lipo in the office, I'm putting it on after those treatments to bring in that oxygenated tissue. Like I said, it's like a mini hyperbaric treatment directed in one area. The thing about genuine actual hyperbaric treatment is you have to go to this big dive chamber, you sit in there for 45 minutes. It's it's a little inconvenient to do those kind of treatments. This is the opposite of that. This is extremely convenient. We can place it exactly where we want it. So in an area that I've treated upper eyelid lifts, chin lipo, 360 lipo, breast procedures, I put it on all of that, and it brings in that oxygenated tissue to help with blood flow, to help with wound healing, to help the scars look better in the long term.
Tell me you don't love CO2 lift without telling me you love CO2 lift. Now,
Exactly.
considering this growing trend, which there is a growing trend towards non-invasive cosmetic solutions, the role of CO2 lift products evolving in the future of aesthetic treatments is very promising. What advice would you give to patients considering any kind of cosmetic surgery but are apprehensive to do so because of the risks of these botched outcomes?
So again, like we mentioned at the top of the interview, seek out a board certified plastic surgeon. That's number one. Number two, do the research on your surgeon. Look at their before and afters. Look at their reviews, especially. See if they have, every surgeon will have some reviews that are unfavorable. You're not going to hit a home run every single time. But what you want to see is the majority of their reviews. I happen to be 5-star on all my reviews over Google, but not just that. Look at how many reviews they have as well. If they have 5 reviews, that's a little bit questionable. If they have 200, 500 or more, that's a good sign that there's unanimously good results with that surgeon. And again, another thing too is also look at how many of those procedures that they've done that you're looking into. Look at the before and afters of the procedure that you're looking into so that you're getting the expert for the procedure that you want to pursue.
Wow. Well, we are officially out of time. No doubt in my mind that you are quite the expert in all the areas of these very, very expert surgeries that you do. Thank you so much for coming on and chatting with us about where they all went wrong so we can all go right.
Absolutely. Thanks for having me.
The mechanism behind CO2 lift's effectiveness, guys, lies in carboxytherapy, where carbon dioxide is infused into the skin, leading to increased oxygenation and improved blood flow. And this process triggers collagen and elastin production, which are essential for maintaining youthful and healthy skin. And of course, clinical data supports that carboxytherapy effectively reduces signs of aging, and such as the good doctor told us, fills in fine lines and wrinkles, and improves overall skin tone and texture. I can personally vouch for that myself. The treatment has been shown to be effective in also reducing dark circles and puffiness around the eyes and really enhance that hydration. And there's an incredible radiance immediately after application. I can attest to that. That was our Going Deep segment brought to you by CO2 Lift. Definitely check out the good doctor at theplasticsdoc.com, where you can check him out on the gram at theplasticsdoc. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by CO2 Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2 Lift. CO2 Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home carboxytherapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase luminosity, and improve pigmentation, sagging, skin tone, and radiance.
For more information or to order CO2 Lift, ask your skincare professional or go to co2lift.com.